trying to go back to the goal of this particular year of 2019, it was I'm going to skate again. Complete with soundtrack, of the hockey night in Canada and stuff like that. I'm going to skate again, and I'm good. So I'm going to do that again.
Right.
And I thought, okay, well, I've got to develop a base. I went to a trainer, and we mixed it up a bit. But after a while, I sort of like locked into a set of exercises, and I wasn't too open to changing that routine, which was probably, you're different about this in how you're very much into changing things. I didn't feel like the trainer I had explained any of the reasons why one would want to do that. So at the end of like in November, when I finally reached the point where I said, okay, I'm going to skate, I I realized that I couldn't really shoot or pass because of the pain that I had in my right shoulder. And you know, this particular club had very expensive trainers. And so I just went in there and I said, look, tell me what I'm supposed to do to rehab the shoulder and I'll do it. And so I got a piece of paper and it was said, I'll do the RCPIX, RC rows, cans, um, internal, external rotation, and pull aparts. And so I did it while watching, the news religiously 5 times a week. They said 25 repetitions of these exercises. And so here I am doing it. And I then thought, maybe I have a range of motion problem with my arm. So why don't I take advantage of physical therapy? And when I went in there, I was very fit and they had me do the arm bike I remember they had to do it at level 8. And I was a little like a wise guy saying, I want you to do that because that's pretty hard. But I was doing I overtrained and felt a strain in my left shoulder. So I actually tore my left rotator cuff, um, trying to rehab my right rotator cuff.
Mm.
And I that was right when COVID happened too, and when it was locked down. So I had 2 months of waiting for surgery, and
Well, explain the process there. So let's hold up. That's
yeah.
so you tore your rotator cuff. How did you know you tore your rotator cuff?
Well, I mean, I was doing the Bosu ball push-ups, and I felt a little bit of a strain, and I had been feeling a little bit of a strain in that shoulder, and I thought this isn't right, and I went to the orthopedic surgeon that I had gone to for my right shoulder, and his response was, "Yeah, we can go in there and scope it out, and if there's anything in there that needs to be cleaned up, we will." And I wasn't really happy with that answer, and looked for somebody else. And I actually found the head of orthopedic surgery at UCSF, who's a god, and who basically recommended things that were less invasive, less risky. It's not like somebody who wants to just follow a routine. It was, but go ahead. I'm sorry. I'm just sort of rambling on this thing, but I found out on my own. I found out that I had pain in my left shoulder, and I was
So,
having difficulty.
so no therapist or trainer kind of said to you, "Hey, maybe you should get some imaging on that left shoulder."
Nobody, no.
Nobody. Okay. And then after you learned that you've got the rotator cuff tear, what was the next steps? You had surgery that
Was
week.
was anger management. I went back into Boston mode. I was like, as you can imagine, right? As you
Yeah.
spend a whole year and
So wait, so there was a year time from when you tore your rotator cuff to when you got the surgery, or you
no,
found
no,
out?
no, it was 2 months. But right after that, when it happened, I did a real drill down on who are the best people in the area outside of, because I had also done some at I'm in Palo Alto, and it's adjacent to this large university that's well known for their medical prowess. And I had gone there too and recognized that they may have a desire to do the most complex stuff. And they were really enthusiastic about my problem, but it wasn't, I feel, an enthusiasm towards solving my problem, but more like an enthusiasm over like the possibilities of trying something new. So,
Was that your
yeah,
first experience with like physicians and surgeons and stuff?
I don't want really the experience with surgeons. Uh, mostly, it's managed care. Someone comes in and they do a quick look and they tell you, "Yep, you got this." And there was never really a it seemed, as far as this last Dr. Benjamin Ma, chief of orthopedic surgery, UCSF. He's the best. You should go and see him if he'll take you. I had to beg, I think, to let me. I said I'm an old guy and I wanted to play the sport. I think he felt sympathetic over what had happened to me, but he I mean, as the great interaction was when I said, um, are you going to remove the calluses or what is that thing when they take the stuff off the growth or whatever in the bone to smooth it out?
The bony growths on the shoulder.
Yeah.
Yeah.
Is that what it is? Bony
Yep.
growth. That's medical term for it. The bony growth.
Osteophytes.
Yeah. Now you're getting. I can't afford this conversation anymore. No, he said, I said, when you're in, because all he said was he was going to fix the supraspinata, not superspinata.
Right.
And
Super, not super.
I learned that from you. And I said, well, when you're in there and you see anything else, because that's all you're going to do, you're saying, can you clean it up? And he looked at me almost angry and said, what do you think my answer is? And I said, well, you can't do it because the insurance won't cover it. And he said, I don't work for the insurance companies. I work for you. And if it were 10 years ago, I would have done that. But now we know that when you do that extra work, it ends up complicating the rehab.
Interesting. So you saw that there's a stark contrast between the conversation you had with the first surgeon to the second one. And the
Yeah,
second
well, he
one
was
was,
looking for long-term outcomes
Mhm.
versus like, here's this guy. And I found that to be the case. Is sort of, I don't know, it's almost like this person doesn't have the motivation or this person is older. And so chances are they won't like, go the extra mile. Like they don't have the kind of, and, you know, I suppose I don't know if it's rare or not, but I was going to go the extra mile. I do want to do that thing again, and so it's almost as if they don't want they expect you to not have the discipline to hang in there, and
Yeah. And that might be
so,
something that, maybe a lesson for up and coming physicians or even physical therapists is, giving a glimmer of hope in even a dark time. Because as a patient, I'm sure it can be definitely difficult, especially when you have something that like changes your life. If you can't play a sport, you can't work out, you can't do anything. I mean, it's demotivating. It kind of throws you off the rails for your life for the most part.
yeah,